Hello and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Artificial intelligence or AI in eye scans helps improve diagnosis of inherited retinal disease. Inherited retinal diseases or IRDs, single gene disorders affecting the retina, are very difficult to diagnose since they are uncommon and involve changes in one of many candidate genes. Outside specialist centers, there are few experts who have adequate knowledge of these diseases, and this makes it difficult for patients to access proper testing and diagnosis. But now, researchers from the UK and Germany have used artificial intelligence to develop a system that they believe will enable more widespread provision of testing together with improved efficiency. I2 Gene, an AI system, is capable of identifying the genetic cause of IRDs from retinal scans. The researchers were able to utilize Moorfields Hospital's vast database of information on IRDs covering over 30 years of research. Identification of the gene involved in a retinal disease is often guided by using the patient's phenotype, defined using the Human Phenotype Ontology or HPO. Blood biomarkers and genomics combo predicts common disease risk more accurately than only genomic information. Polygenic risk scores, where genomic information alone is used to assess the risk of developing diseases, have been receiving a lot of attention recently. But research to be presented at the annual conference of the European Society of Human Genetics on 10th June suggests that combining blood biomarkers with genomic information gives more accurate, cost-effective results. The researchers used machine learning to build predictive models for individuals' future risks of 9 common diseases based on their genetic information and the biomarkers that they measured. The diseases studied were ischemic heart disease, stroke, lung cancer, diabetes, chronic obstructive pulmonary disease, Alzheimer's and other dementias, depression, liver disease and colon cancer. New gene therapy proving safe and successful in sickle cell anemia's treatment. Researchers presenting preliminary data from a clinical trial aimed at discovering a cure for sickle cell disease revealed positive results among its first patients. Sickle cell disease, a genetic blood disorder, is a painful and debilitating condition for which there are few approved therapies. Researchers involved in the multi-center Ruby trial presented an update on the safety and effectiveness of a single dose of EDIT-301, an experimental one-time gene-editing cell therapy that modifies a patient's own blood-forming stem cells to correct the mutation responsible for sickle cell disease. The first 4 patients, 2 of whom were treated at Cleveland Clinic Children's, had their stem cells collected for gene editing. The patients then underwent chemotherapy treatment to destroy the remaining bone marrow, making room for the repaired cells that were later infused back into their body. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.